I'm Andrew P DeFillipis from the Vanderbilt University Medical Center. Yeah, that's a great question. So we know that anemia is common in myocardial infarction, and while we have trial data to establish transfusion thresholds for many patient populations, the data really does not exist for the acute myocardial infarction patient with anemia, and that was the context for which the MINT trial was performed, where we randomized 3,504 patients with acute MI and anemia to a restrictive versus a liberal transfusion strategy. Yeah, so we know that type 1 and type 2 MI are different pathophysiologically, and we know that the patients that present with type 1 or type 2 MI are also different. And so it's reasonable to think that transfusion would affect those patients differently. So the objective of this subgroup analysis was to look at the efficacy of a restrictive versus a liberal transfusion pattern in type 1 and type 2 MI patients with anemia. Overall, type 1 and type 2 MI patients had similar primary outcome. Our primary outcome was death or MI at 30 days. It was high for both, 15, 16%, and same for both of them. But when we looked at comparing, does the restrictive versus the liberal transfusion strategy act differently in a type 1 MI patient versus a type 2 MI patient population, we found some interesting findings. So first of all, in the type 1 MI patient population, there were more primary events at 30 days, 18.2% for patients with type 1 MI compared to 13.8% for those with type 1 MI randomized to the liberal transfusion strategy. And that gave us a relative risk of 1.32 and a confidence interval that didn't cross 1. We didn't see that for type 2 MI. We saw similar event rates of death or MI at 30 days, but really no difference between the restrictive and liberal transfusion strategy. So that was a very interesting finding in itself. However, when we look at the gold standard or the statistical analysis of, is this transfusion strategy treating the type 1 and type 2 MI patient populations differently, meaning are they responding differently? That test of interaction was not significant at a p-value of 0.16. So a little bit of inconclusive data there. I think what it tells us is we didn't prove that one transfusion strategy is better than the other in type 1 or type 2 MI, but certainly we have seen data, and this is consistent with the overall results of the MINT trial, that the data does raise concern that that restrictive transfusion strategy may be harmful compared to a liberal transfusion strategy in patients with acute MI and anemia, and with this subgroup analysis, maybe particularly so in patients with type 1 MI. Yeah, I think there's been really good trial data in many patient populations that over the last many years have established a restrictive transfusion strategy appropriately in many patient populations. But specifically for acute MI and anemia, this data raises concern that this may not be appropriate, as particularly for type 1 MI patients. We need to continue to investigate this issue and really work to find what is the most efficacious transfusion threshold for type 1 and type 2 acute MI patients. Yeah, I think that we need to understand transfusion in these different MI types better. And not only just type 1 and type 2, but other MI characteristics, the size of the MI, ST elevation or not MI, and that's kind of ongoing research that we have from the rich data set that's been created by the MINT trial, and we look forward to doing those analyses and getting that information widely disseminated.